I'm Dr. Prashant Chhaje. I'm a senior chest consultant at Lilavati Hospital, Mumbai. Today we are going to discuss about pneumonia. We often hear the word pneumonia, but now in the next few minutes, let's discuss what is pneumonia, what is the incidence of pneumonia, what are the symptoms of pneumonia, who are the individuals who are at a high risk of getting pneumonia or severe pneumonia, what are the symptoms, how we can identify it early, what are the common tests, and what is the treatment approach. So first, what is pneumonia? Pneumonia is an infection in the lung. This can be caused either by bacteria, viruses, tuberculosis, or fungi. So when these organisms infect the lung, they cause an inflammation. There is a swelling in the lung, and when the inflammation is more than a particular extent that it causes a consolidation or a patch, then that is called as a pneumonia. The word consolidation is synonymous with pneumonia, and consolidation means because of the inflammation, a part of that lung almost solidifies. What are the symptoms of pneumonia? There is inflammation, as I said, so there are symptoms related to inflammation. Now, depending on the extent of the inflammation, depending on the extent of the consolidation, one will get the symptoms and the severity of the symptoms. The common symptom is high-grade fever and cough. There can also be associated chest pain. All this can happen at an interval of a few days. If the pneumonia is severe, there can be breathing difficulty also, and there can be shortness of breath. So whenever these type of symptoms are present, which last for more than a couple of days, and an individual is uncomfortable, the first thing you should do is you should see your doctor, and the doctor will investigate you with common tests which are there for high-grade fever. That would include a blood count, it would include an X-ray chest, it can also include some other tests such as urine test and other tests to rule out or look for other causes of high-grade fever. In case of pneumonia, typically if it is a bacterial pneumonia, there will be an increase in the WBC count, the white cell counts. A CRP, that is a C-reactive protein, is a common test that is done to ascertain the amount of inflammation, and because of the COVID pandemic, the CRP became quite popular and quite well known. So CRP is one of the tests that can be done. The CRP can also be raised, and an X-ray chest is typically done. If the inflammation is quite severe, then you may see a patch on the X-ray chest. Sometimes, along with these symptoms of high-grade fever, cough, breathlessness, the X-ray may not show any changes, and your doctor may ask you to do a CT scan of the chest. Now, after having discussed about pneumonia, how common is pneumonia? If you look at the estimates in our country, it could be about 0.5 to 1% of the population may have symptoms of pneumonia at some point. If you look at the world numbers, it is estimated at 1400 individuals getting pneumonia per 1 lakh per year. So that is how common pneumonia is, and pneumonia can be quite severe, if it is extended to both the lungs. So we've discussed the incidence of pneumonia, we've discussed the symptoms of pneumonia. I discussed with you also the common tests that are done for pneumonia. Now, how do you approach the treatment of pneumonia? Now, depending on the severity of pneumonia, how stable the individual is, the treatment can be either done on an outpatient basis, where a doctor will prescribe you the required antibiotics for maybe 5 to 7 days typically. And that is typically when the pneumonia is not complicated. If the pneumonia is severe, if the patch of the pneumonia is quite big, or it is involving both the lungs, then the doctor may ask you to get hospitalized for pneumonia, and you may be needed to be treated with appropriate intravenous injections. If there is breathing difficulty and drop in oxygen saturation, the pulse oximeter also became quite popular in the COVID pandemic. So if the oxygen levels are low, below 95%, then the doctor may also supplement you with supplemental oxygen. And that is one of the reasons why an individual may need, or one of the indications for hospitalization is a drop in oxygen level. If the pneumonia is too severe, in some cases, then the individual may need also to be hospitalized in the intensive care unit, treated with appropriate antibiotics for bacterial pneumonia. Sometimes, if it is a viral pneumonia, one may need to be given antiviral medication. If it's a tuberculous pneumonia, typically these are treated on outpatient basis, but sometimes one may need to hospitalize such individuals also. These are diagnosed and treated appropriately with anti-TB drugs. And if there's a fungal pneumonia, then these fungal pneumonia are treated typically with antifungal agents. Now, who are the individuals who are at high risk of getting a pneumonia? Pneumonia is typically common in children or in individuals who are more than 50 years of age. There are some individuals with chronic diseases such as asthma, COPD, or an interstitial lung disease, or any chronic lung disease, for that matter, diabetes or renal disease, chronic renal disease. These are the individuals who are at a high risk of getting infections, and including, of course, those who are immunosuppressed, who are on immunosuppressive medications such as steroids or after transplantation, or those individuals who have received cancer therapy. These are the group of individuals who are at high risk of getting infections and also a high risk of getting pneumonia, and therefore the index of suspicion should be very high in these group of individuals. Now lastly, about prevention. As far as prevention of pneumonia is concerned, there are various types of vaccines available. The vaccines which are available are the pneumococcal vaccines. There are flu vaccines which are given on a yearly basis. The pneumococcal vaccines, there are some which can be given once in lifetime. There are some which can be given once in 5 years. And now, of course, the COVID vaccines are also available. And I think a lot of us have already been vaccinated with the COVID vaccines. And at appropriate time, the boosters should be taken. So for the vaccination purposes, particularly those individuals who are high risk should see your doctor and ask if you qualify for a vaccine and get yourself vaccinated to prevent pneumonia.